So part B. Yes, go through this question. Pratiksha, Suji, Uppula, Manjula, Amrita. Fine. Find out what exactly he's talking about. Think about it. Yeah. So, now see this background. You hear. So you are hearing, but you have to listen. The manager of a care home for the elderly is talking to the nursing staff. So the nursing staff more than one. One is talking to many. It's one way. Right. He's talking to the nursing staff. Now let us see. He says, that means you should be ready to listen to the manager's voice. He, man's voice. Okay, that means man is speaking. So he's talking about errors. Errors result from. Errors are the results. So cause, what is the cause of these errors? Errors are the results. Then what are the causes of these errors? That's what he's asking. Results from. From the cause to the result. Cause and effect. Effect is errors. Effect is errors. So what is the cause of these errors? So errors is the result. So from what is it resulting? So what is the reason for these errors? Now you have to see one thing here. You have to see one thing here. Interruptions while calculating dosages. Is it about dosage? A failure to check for patients' allergies. Allergies. Administering drugs late in the day. Drugs. So, try to understand this one. So, what is he saying? What are the reasons? Okay. What are the reasons? Is he talking about dosages? Is he talking about allergies? Is he talking about drugs? He may be talking about everything. He may be talking about everything. But he's telling about usually. This is the most important thing. Usually, write down usually, generally, commonly, regularly, normally. So that is the synonyms. Okay. So what is the reason? Okay. When somebody is calculating dosages, that time if somebody talks or somebody gets disturbed, he will give wrong dosage. Okay. A failure to check for patients' allergies. Allergies, you have to check. Because you did not check for allergies, errors are happening. Administering drugs late in the day. Late in the day means evening, night, not early in the morning, not in the afternoon, late in the day, not early. Late means after 12 p.m. Afternoon, evening, night. So that is late. You have to think about these things. Okay, he'll be talking about all the three things, but you have to focus on these three areas. You are calculating dosages. That's why somebody comes and says something, some disturbance or some fight, some quarrel or something is there. Okay, suddenly something happens, interruption. Somebody falls down, somebody shouts, some interruption, some music or something. So when you are calculating, something is happening, exact time something is happening. So because of that one, errors happen. Because you cannot focus, you cannot concentrate. Second thing is patient's allergies. Patient has an allergy and you did not check for the allergy and you are giving medication. So because of that, is affected. Because of your mistake, allergies. You did not check. Third one is administering drugs late in the day. What time should the drugs be given? Okay. So in the evening, if drugs are given, errors are happening. Administering drugs late in the day, errors are happening. That means early in the morning, not happening. Late in the day. So these three areas you have to focus. Dosages, problem with dosages. Something negative will come. That is errors. Problems with allergies, something negative will come. That is errors. Because errors is negative. There's a problem. There's a problem. So you're doing something, measuring dosage, calculating dosage. That time some disturbance. There's a reason. Allergies, patient has, you did not check, that's why. So allergies is problem. Drugs, late in the day. Giving drugs early in the morning or late in the evening, that is time. So drugs is the problem. Is it the amount or is it the allergy with the, or is it the drugs delay, late or early, timing of drugs. So that you have to focus. These are the three words which you have to focus. Then you will get the correct answer. Okay. Interruptions. Interruptions is negative. Failure is negative. Late is negative. Early is positive. Late is negative. So you have to focus on dosages, allergies, and drugs. All others are same. So this is how you will be checking. Okay. So focus on this particular area. Yeah. Errors means negative. Negative with dosages, negative with allergies, problem with dosages, problem with allergies, problems with drugs. So which is the main reason? What is negative here? That you have to focus. Yes, next. Second question. Yeah, we can take this one only. Better. So, what I was talking again? 25 to, I think I took this, what I took here, 25. That is question number 26 I have taken. Okay, 25. Okay. Now let us take this point. Yeah, yes. So let us see like this. You hear a nurse, question number 25. 26 we have seen now. So 20, yeah. Yes. You hear a nurse briefing her colleague about a patient. You hear a nurse briefing her colleague about a patient. What does she warn her colleague about? Is the picture very clear or do you want me to make it big? Yeah. Yes. You hear a nurse briefing her colleague about a patient. So, a nurse briefing her colleague about a patient. So, she is warning. She is warning. Warning about some problem. You are warning. Hey, be careful. Some problem is there. warning. Okay, warning about some problem. What is she warning about? The patient is allergic to some types of antibiotics. Allergy is the problem. The patient is allergic to some types of antibiotics. Allergy is the problem. Care must be taken to prevent the patient from falling, because the patient will fall down. Patient is, okay, he will fall down. Patient will fall down. Oxygen may be needed if the patient becomes breathless. So breathlessness is the problem. Breathing is the problem. Allergy is the problem. Allergy is the problem. Falling is the problem. Breathlessness is the problem. Breathing is the problem. Try to understand this. So antibiotics, the patient is not ready for such antibiotics. So he has allergy. So he will get some problem. So be careful. That's what she's telling. Care must be taken to prevent the patient from falling. Patient has a chance to fall down. He cannot be strong. He is weak. He will fall down. So you have to be very careful. Oxygen may be needed if the patient becomes breathless. Oxygen. So breathlessness, breathing is the problem. So these are the words. Warning about. Now what do you mean by warning about? Try to understand that. Warning about. So here, warning about is what? Caution. Stop. Be careful. There's a problem. Be aware of it. Otherwise, there will be some serious consequences. So you are giving warning. Warning is to prevent something negative. Okay. Be careful. You will fail. Be careful. You lose your money. Be careful. You lose your health. Be careful. You lose your money. That is how it is. So you are warning so that something negative may not happen. So the word warning, whenever it is there, be very careful. It's a problem. To avoid the problem, you are warning. What is that problem? Allergy is the problem. The patient is allergic to antibiotics. Antibiotics are not the problem. He has allergy. So allergy is the problem. Because of that allergy, he cannot take antibiotics. So antibiotics are not problem. 1 out of 100 or 1 out of 1,000 may have allergies. Allergies. Penicillin. Many people get penicillin, but some people are allergic to penicillin. So try to understand what I'm telling you here. So penicillin is not a problem. He has allergy. That allergy is a problem. That's why he cannot take penicillin. So don't think penicillin is a problem. So you cannot think about penicillin. It's about allergy. Next one. Care must be taken to prevent the patient from falling. That means patient falls down. So you have to be careful. Patient may fall down. So you have to be careful. The patient may become breathless. So breathing problem. The patient has breathing problem. Maybe asthma or something else. Breathing problem. The patient has breathing problem. So in that situation, he will suffer. So immediately oxygen should be given so that he will become normal. So breathlessness is the problem. So consider about allergy, consider about falling, consider about breathlessness. These three things will be there. Along with these things, negative may be there. He has no allergy, means no problem. He has allergy, means problem. So A will be the answer. There are chances to fall down. He may fall down. He will fall down. He is very weak. He cannot stand properly. So then it's a problem. He has no problem now. He is strong. He is steady. He is recovering and he has no problem. He will not fall down. He can stand on his own. So then no problem. But you have to be very careful. He fell down many times. He may fall down. So be very careful. So that means negative. Then so negative word will come there. Breathlessness. His oxygen level may fall down, he may become breathless, so he may panic. So these are negative words. Panic, may become breathless, cannot breathe. Okay, he is prone to breathlessness. Okay, it's like that. So negative word will come. Then this is the answer. If it is no, if it is positive, then not must. So you have to see, already the allergy is a negative. Okay, no allergy, no problem. Allergy is negative. No allergy means falling. He will not fall down. So no problem. He will fall down. So these are negative words. So you should see positive. Positive means no problem. Okay. These are negative words. Already negative words. So another negative word, it will become positive. He is not allergic. That means he is okay. So why should he go on? Negative word with another negative is positive. He is not allergic. He is allergic, problem. He is not allergic, no problem. Problem is problem. No problem is positive. Problem free. Falling is falling down. Problem. He will not fall down. He is sturdy. He is steady. He is strong. So no problem. Then breathless. He becomes breathless. His breathing is fine. He becomes breathless. No negative. Okay. Breathless is already negative. No another negative. So it becomes negative. He is not breathless. Less and not cancel. So breathing okay. So like this you have to say. Double negative is positive. Double negative is positive. Not allergic. Allergy is negative. Not allergic. So positive. Falling. Does not fall. Falling is negative. Falling is negative. Does not fall. Okay. Positive. Not fall. Means okay. Positive. So see whether the negative word is coming or not. If the negative word is coming, then no problem with it. If negative word is not coming, it is already negative. Okay. Right. Next, breathless. Not breathless. Less is negative. Full is positive. Okay. Hopeful, positive. Hopeless, negative. So less is negative. Okay. Less is negative. So not breathless means breath is okay. So like that. So see that negative word with not. Negative word with another negative. Negative plus negative is equal to positive. So no need to warn. If there is no negative, already one negative is there. Okay, negative plus positive is equal to negative. Remember that. So be very careful how you are going to choose this word. Next. So 26th, I already told you. 26th, I already told you. What are those? Once again. So errors. Questions will be negative only. Questions means problems. Problems means warning. Problems means error. Problems means error. So error regarding dosages, wrong dosage. Errors regarding allergies. Okay. Failure to check. And drugs. Is it regarding problem with the dosages? Is there a problem with dosages? No problem with no interruptions is positive. Interruptions is negative. Somebody comes and disturbs you. Disturb is interruption. Intervene. Disturb. Okay. So negative word. So is a problem. So be careful. Here dosage is positive. Allergy is positive. Okay. Drugs is positive. Both of these things. Allergy is a negative one first of all. So failure to check allergies. Failure is negative. Then next, late, not early, late. So see this, these words you see, dosage, allergies, drugs. So problem with allergies, you're counting some. Problem with dosages, you're counting, somebody came in immediately, well, then you forget this one. Then next one, a failure to check the patient's allergies. You don't even discuss with him. So that is why problem. Administering drugs late in the day. Late in the day, that means you become tired. Maybe. Because of that, you are administering drugs and you will create some problem because you are already tired. Like that. So see these things. Okay. Next. You hear a part of a morning briefing on a hospital ward. You hear a morning briefing on a hospital ward. Yeah, on a hospital ward. On a hospital ward. You are a morning briefing on a hospital ward. What is the plan for the patient today? What is the plan for the patient today? So today plan. So that means he will be talking about yesterday, he'll be talking about today, and he will be talking about tomorrow. Or he'll be talking about last night, and this day, and next night. So try to understand. Last night, maybe he was admitted, or yesterday he was admitted. Tomorrow he will be discharged. Last night he was admitted. Today treatment. Tonight he will get discharged. So whatever it is, what is the plan for the patient today? Today means these 24 hours. Yesterday, today, tomorrow. Or last night, today, tonight. It may be anything. Day, today is there. So you have to understand this one very clearly. Yeah, Mahesh, Pratiksha. Okay. So today, whenever I take night classes, no, be ready to attend because I will be in full energies. Okay. As it becomes night, my energy levels will go up. So I'll be explaining fully. So today, the point is, what is the plan for the patient today? That means he will talk about yesterday, when he got admitted, today, the progress, tomorrow, discharge. So he will be talking about past, he will be talking about present, he will be talking about future. So remember that one. So don't get confused. Today is important. When he joined last night, everything was fine. Today we have to check. Tomorrow, when he is stable, we can transfer to the general ward. Maybe like that. So you have to see past, present, future. He's asking about present, not past, not future. So focus on the present. This is time-based question, time-based question, time-based question. That's it. Why is that plan? Because there is a problem. Problem with what? Is it with his emotions? His emotional, his problem with emotions, emotional problem. That means mental problem. It is mental problem. Her mental state will be carefully observed because there is a problem. She has a problem. Here also problem is there. Today we are observing her something. So she has some problem. Is that problem related to mental problem? Mental state, mind. Her mind is the problem here. Her mind is the problem. Number one, she will be transferred to a more specialized unit. She will be transferred to a more specialized unit. That means this unit is a problem. This unit is a problem because this unit cannot treat her. This unit is not a special unit. This is an ordinary unit. So she will go to a special unit. From ordinary unit to special unit. So unit is the problem here. She is not the problem. Unit is the problem. This unit cannot treat her. That's why she will be transferred to another unit, specialized, more specialized unit, because this is a very ordinary unit. This is not a special unit. This is ordinary unit. So we'll send her to a more specialized unit. So try to understand that one. Unit is the problem. Unit is the problem because this unit cannot treat her. That's the problem. Next one. A social worker will come to see what help she needs. A social worker will come to see what help she needs. That means she needs a physical help. She cannot do it on her own. She cannot do on her own. She needs a social worker to help her. Okay? To help her. Maybe to give a bath, to dress change, to change the dress, or to take her for a walk, or to feed her because she cannot eat on her own. So this is a physical situation. She needs physical help. First one is mental problem. Third one is physical problem. Second one is not her problem at all. First and third are personal problem. Second one is external problem. The problem is not related to her. The problem is related to the hospital unit. First one is her problem, mental. Third one is her problem, physical. Second one is not her problem at all. So emotional problem, physical problem because her body is not capable to do things. Okay. The body is not capable to do things. For example, taking bath, feeding. She cannot feed herself. There is physical problem. Hands are weak. She cannot eat. So that may be powdered and maybe she cannot eat apples, maybe juice. She needs. So she has social worker will make juice and give her. So because physical problem, not mental problem. First and third are her problems, patient's problems. Second one is hospital problem. First one is mental problem. Mind is some problem. So third one is body is the problem. Body, mind, external, physical. Mental, external, physical. A is mental. So what about his mind? What is he talking about his mind? Is the mind a problem? She has no problem. This is okay. We can treat. The hospital can treat. But this unit cannot treat. So we'll send it to a more specialized unit. So unit is the problem. No problem with her. She can be treated. The problem can be treated. There is no problem with her problem. Because this hospital can treat. But this particular unit cannot treat. So unit is the problem. So next, we'll send you to another specialized unit where that unit can treat. So that means treatable problem. Problem is not a problem then. Third one is physical problem. She cannot handle those things because her strength, her energy, her ability is lacking. Any one of them lacking is lacking. So somebody has to help her to fulfill these activities. So social work. So try to understand it. Emotional, maybe yesterday. So these three things related to three different things. One may be past, one may be present, one may be future. So think what it is related to. Related to today. He will be talking in present tense, not past tense. Yesterday she came. Okay. She was not able to do anything, but now she is able to do. That means in future also she can be able, she can do. She will be able to do, or she can do. So try to understand that. He may talk in past tense, he may talk in present tense, he may talk in future. We are bothered only about present tense. Today, remember that. Only focus on this. So you have to analyze the questions like this. Doing the answer is easy. Listen and do answer, whether it is right or wrong. Okay. Fine. So next one, next question. Next 34th question. Go through 34th question, please. Yeah. Yes. Next one. Oh. Sorry. So 27 over. No? Yeah, 28. Thank you. You hear a part. You hear a part of an antenatal consultation at a GP practice. You hear part of an antenatal consultation at a GP practice. What does the patient want to know about? Antenatal. What do you mean by antenatal? Anti means opposite, backside. Post, forward. Antenatal, natal, postnatal. Antenatal means before, anti-clock. Clockwise, anti-clockwise. Clockwise means 12, 1, 2, 3, 4, like this. Anti-clockwise, 12, 11, 10, anti-clockwise. So this is clockwise, this is anti-clockwise. Anti-clockwise means going backwards. So that means before birth. Antenatal means before birth. Postnatal means after birth. So remember the antenatal, prenatal, postnatal, like that. Different things will be there. Antenatal means before birth. So antenatal consultation. What does the patient want to know about? What does the patient want to know about? That means she doesn't have knowledge. That is a problem. Lack of knowledge is a problem. So she wants to know so that there will not be any problem. Every question is circumventing a problem. Every question is related to a problem. So before birth, there's a meeting, consultation at a GP practice. She wants to know about something because she does not know about it. She is afraid something wrong may happen. That means if she doesn't know, there is a problem. She wants to avoid that problem. So her heart is warning about the problem. So she wants to know something. She wants to acquire knowledge so that she can avoid that problem. So what may be the problem? The advisability of a home birth. So home birth is a problem, whether I should go or not. Shall I take home birth or shall I go to the hospital and give birth? So advisability of home birth. If it is a problem, then she will not give birth at home. She will go to the hospital and get admitted. Second one, ways of avoiding postnatal depression. Postnatal. After birth, there may be bleeding, there may be pain, there may be anything. The body shape or whatever it is, or changes, physical changes, or the pain, suffering. Okay. So all these things, because of that, she may get depressed. Chances are there. So she wants to avoid postnatal depression. Postnatal depression. Whether home birth is advisable or not. That means during birth, at home or not. Second one is postnatal, means after birth problems. What painkillers might be available during labor? This is during birth. First one is before birth. Second one is after birth. Third one is during birth. Remember that one. Here also, there are three things. Before. This is not past, present, future. This is not past, present, future. This is before, during, after. This is third type. This is another type of question. Write down. Before, during, after. Before, during, after. Is she talking about the problems before birth? Okay. After birth, there may be problems. Is she talking about that? During birth, there may be problems. She is talking about that. So try to understand the advisability of a home birth. You need it before only, not during, not after. This advisability should be before. The next one, ways of avoiding postnatal depression. Birth is done. Afterwards, you may get into depression. So to avoid that one. So this is after birth. What painkillers might be available during labor? During. So before, during, after. Postnatal is after. So try to understand the style, how he has divided. Okay. Advice you take before. Advice you take before. So now this is the way how you have to say during. During is what? At the time of the birth. Not now, at the time of the birth. Postnatal, after birth. Advisability, advice before birth. When do you give advice? You give advice for the past? No. You give advice for the present? No. You give advice for the future. Suggestions will be given for the future. So this is pre, this is while. A is pre, B is post, C is while. While means during. Okay, pre or anti means before. Post means after. So remember that. This is how this question goes. The next one. These sessions are for the exam going students, but exam going students won't have time for attending. You know that. We don't mind, we'll do our work. That's not our problem. So this 29th question. 29th question. Yeah. You hear a trainee doctor telling his supervisor about a problem, again problem. Every question is based on a problem, remember that. He had carrying out a procedure in the past. The trainee feels now the cause of the problem was, there was a problem. What was the cause? What was the cause? There is a problem. Problem is the effect. Problem is the result. What was the cause of the problem? This is a cause and effect question. Cause and effect question. Cause and effect question. 6330 7334 696. Yeah. So you hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. So trainee doctor is telling supervisor he had a problem. He is telling about the problem. He was doing a procedure. He had a problem. What was that problem? That some problem is there. So what was the cause for that problem? So this is cause and effect. Cause, he's asking the cause for this result. Result is the problem. Cause of the problem. Treatment administered previously. Previously means before. Previously means before. So he's talking about the treatment. Treatment is the problem. Treatment is the problem. Patient's negative reaction. Patient is the problem. First one is treatment is the problem. That means doctor problem. Problem by the doctor. Doctor is a problem. Before doctor gave treatment, that is the problem. That became a problem now. So your patient is a not problem in A. Treatment is the problem. Means wrong treatment. Or that treatment is affecting the present treatment. They are clashing. And B, patient's negative reaction. Patient is the problem. Patient is the problem. Third one, doctor is not a problem, patient is not a problem, equipment is the problem. Equipment is a problem. Inappropriate equipment. Inappropriate is negative. Negative is negative. Previously administered, that is a negative problem. So treatment is the problem, the patient is a problem, or equipment is a problem. What is the problem here? This problem occurred because of previous doctor. He did something wrong. Patient's negative reaction. Patient was problem. Inappropriate equipment. The equipment, the machinery is the problem. So doctor, patient, or equipment. Now you are giving an injection. Doctor. Doctor is doctor prescribed medication. Medication was administered. Doctor gave. So doctor prescribed medication. Nurse gave. But problem with the doctor, not with the nurse. So doctor prescribed. Doctor administered medication treatment. So doctor is the problem here. Now, when the doctor is giving medication, patient, was not listening. Okay, because of that, what happened? Injection has gone something wrong. So patient's problem. He's afraid of the injection, maybe. He just suddenly the injection, instead of that one, there was a cut. And it started bleeding. So Doctor is not a problem. Patient is a problem. Then next one. Doctor gave medication. Patient also took. But the injection, the syringe, what you have given, instead of giving a 0.5, you give 1.0. Some measurement. Instead of taking thin needle, you took a thick needle, maybe. You're not supposed to take thick needle, but you get thick needle. Maybe. Instead of injecting slowly, that injected very fast. The flow was very fast, maybe. The body could not take this speed movement or something like that. So equipment was faulty. First one is fault with the doctor. Second one is fault with the patient. Third one is fault with the equipment, machinery. See how he's, this is how you have to analyze the question. You hear a doctor talking to a teenage boy who has a painful wrist. Painful wrist. Pain is the problem. Pain in the wrist. Pain is the problem. Pain in the problem. Now see, this is another type of question. This is another type of question. Okay. See, the doctor wants to establish whether a fracture means one. A fracture may be misaligned. One fracture may be misaligned. One fracture. There may be more than one. It's more than one, not one, more than one. Remember this one here. More than one bone affected means fractures. More than one bone affected. Not one, more than one. So first one is singular. Last one is plural. And the swelling may be due to a sprain. A sprain. This is not fracture. This is a sprain. So that means you see here, this is zero fracture. This is one fracture. This is 2. 1 plus means more than one. So you see this here is the number. One fracture. This is just because of a sprain, because no fracture means zero fracture. More than one bone, that means not one, more than one. So this is singular, this is plural, this is nil. Single fracture, double or more than double, triple, double or triple fracture. This is nil fracture. This is nil fracture, zero. Zero fractures. This is only one fracture. This is more than one fracture. Try to understand that one. So here you have to focus on the number. You have to focus on the number. Hope you understood. I told you, even if one student is there, I will teach. When I start teaching, I will not stop. Yeah. So you can give your feedback regarding the session if you have understood. Okay. Because all are different concepts. You have understood or not? Is it clear or not? What do you want to say in one sentence? You can tell. You have to tell in one particular sentence. I got a free flight ticket. Okay. Yeah. So now we'll play the audio. So get ready, I'm playing the audio.
Part B. In this part of the test, you'll hear 6 different extracts. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
OK. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, she endured it without a murmur. I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right, well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. But you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
OK.
That is the end of Part B. Now look at Part C.
So now let us check your answers. Okay. Mahesh, Manjula, Pratiksha, Uttala. Good. Good students. So now I'm asking you the questions. 25. Question 25. Yes. 7, 6, 5, 4, 3, 2, 1. Submit. Question 26. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 27. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 28. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 29. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 30. 7, 6, 5, 4, 3, 2, 1. Submit. So now let us check the answers. Yeah. 25. Twenty-five. 25 is B. Update your score. 25 is B. Update your score. 1 by 1 or 0 by 1. Yeah. 26A. Update your score. 27 is A. Update your score. 28 C. Update your score. 29 A. Update your score. 30 A. Update your score. 'Yeah. So let us call it a day. It's already 1:40. So we need to take rest. So we have done a good job. So that's fine. I'm happy that you're scoring full marks. That's really Very wonderful. Yeah. So only 4 students are there, and I'm happy. Yeah. Let us start with Mahesh. Hello, Mahesh.
Yes, sir.
Yeah. Can you share your experience, Mahesh?
Yes, sir. It's good experience because I already attend this session also for this class.
I'm not talking about questions, marks, and answers. I'm talking about what you have learned. Any new things you have learned that you can share.
Yes, sir. You have described very well. All the all option we have to assess before listening the when we have like 30 minutes time or 30 seconds time for the questions.
Yeah, that's good. Pratiksha,
Yes, sir. Good evening, sir.
good evening, Pratiksha. How are you?
Yes, sir, I'm good, sir.
Yeah, share your experience. What new things you have learned?
Yes, sir. The session was really helpful for us, and the technique you taught it will really help to find the answers of part B, because previously it was little bit confusing, like what can be the answer. But this technique, if we apply this technique, then it will really easy to find out the answer.
Okay, how many marks you got in this?
So 6 marks.
Very good. No problem. See, but the thing is, whether you got marks or not, that is not important because this is not the test. So whether you have learned the tricks and techniques, that is more important, right?
Yes, sir.
Yeah. Uppula.
Good morning, sir.
Yes.
Sir, today the session, in each question, you are giving us some hints, what all to check in the listening part. So once you are making us trained to look out for specific words, definitely it made me to understand the concept in the listening. So I think I really gained much knowledge on this, how to focus on the words which are in the question and look into the text, sorry, look into the audio, so that I think most of our answers will be cleared.
Yeah.
And I
Okay,
got
then
five,
that's,
five, six.
yeah, thank you very much. Yeah, that's the end of the session. So we'll meet tomorrow with more questions, and tomorrow we'll take a reading because we have taken listening. Tomorrow we'll take reading.